This is the study guide for Chapter 7. Always code to the highest level of specificity. What do you never do when coding? And it doesn't matter which coding system is being referred to. You never code straight from the index. What is the $5 word for sickness? Morbidity. What is the $5 word for death? Mortality. What is the $5 word for having two or more diseases or conditions at the same time? Comorbidity. What is the $5 word for the cause of a disease or condition? Etiology. What is the $5 word for the symptoms or results of a disease or condition? Manifestation. What is the $5 word for prevention, such as dental cleaning? Prophylaxis. $5 word for diagnosis or procedure named after a person? Eponym. $5 word that means the patient should not do something when taking a medication? Contraindicated. $5 word for the physician made an error, usually in surgery? Misadventure. What does OTC stand for? Over-the-counter drugs. What is dehiscence? It is a splitting open or separation of the layers of a surgical wound. What is marsupialization? Keep it simple. Making a pouch. Who or what publishes or owns the CPT? The AMA, American Medical Association. 16. What manual or manuals may be needed to code outpatient procedures? CPT and HCPCS Level II, Current Procedural Terminology, and Healthcare Common Procedure Coding System Level II. Do not forget your levels or you will not get credit. What manual or manuals will be used for inpatient procedures effective 10/1/2015? ICD-10-PCS, International Classification of Diseases, 10th Revision, Procedure Coding System.
Question 18.
What manual or manuals is used for supplies, ambulance codes, drugs, etc.? And why is it needed? The manual is HCPCS Level II, which is maintained by CMS, Centers for Medicare and Medicaid Services. The AMA did not include codes for these types of services and supplies in the CPT, but we need to be able to bill these items on a claim form. HCPCS Level II is used for more than Medicare patients. For example, drug codes, J codes, drug codes.
Question 19.
A Medicare patient presents for her annual flu shot. Both the CPT and HCPCS Level II have codes for the administration of the vaccine. What coding manual will you use for this and why? You are going to use both HCPCS Level II and CPT. You will use the HCPCS Level II code for the administration. If CMS went to the trouble of creating a word, CMS wants you to use it. You will use CPT to code the actual substance itself, the vaccine. So you actually need both manuals for a Medicare patient getting a flu. To be repetitive, you need HCPCS Level II. It will be a G code. You will use that for the giving of the vaccine, and you will use the CPT for the codes for the vaccine itself. Vaccine codes, substances are not J codes.
Question 20. When will the 2018 CPT codes become effective? They will become effective January 1, 2018. When will the 2018 HCPCS Level II codes become effective? They will also become effective January 1, 2018.